Hi, my name's Elle. I'm the Nursing Clinical Informatics Analyst for the Emergency Medicine and Access Project team.
Hi, my name's Alan. I'm the Medical Clinical Informatics Analyst for the Emergency Medicine and Access Project team. Today we'll be introducing FirstNet to you and also introducing you to Launchpoint, the tracking page, and some of the new functions that will be available to us. Launchpoint will be your landing page in FirstNet. It is a streamlined view of patient details and a quick snapshot of patient presentations. Launchpoint is a clinician-focused view with quick links and notifications to assist with managing and monitoring patient care. Launchpoint shows important patient information on the tracking screen, including the location of the patient in the department, the triage category, patient information, and length of stay. These icons here and here provide a visual alert of potential issues in patient care. For example, infectious alerts, early representations to ED, the presence of mechanical restraints, or an elevated behaviour of concern score. Clinicians will be able to assign themselves to a patient from Launchpoint directly and clearly view other clinicians who are involved in care. These columns here represent our treating clinician, registered nurse, emergency mental health, and our advice, coordination and expertise clinicians.
Here you can see our status column that uses colour and keywords to represent the stage of care and flow the patient is experiencing. For example, here you can see the colour pink that indicates triage is required. And here you can see in the dark blue that doctor treatment has started. You can also easily see the bed request and the bed allocation status, the treating team, and any specialty requirements for the patient. All of our vital signs will be entered into FirstNet and the observation chart will be continuous, following the patient on their journey throughout the entire hospital. The most recent set of vital signs will be visible to ED clinicians face up on Launchpoint. You'll be able to easily see any trends that the patient is displaying, and the use of colour indicates abnormal vital signs. Here you can see the nurse activity column and the provider or the doctor activity column. These activity columns display task alerts, the status of investigations, and consult referrals. Nursing staff will receive a notification of a pending task here, and medical staff will see notifications here. Each of these columns will display the status of different types of investigations. For example, you can see medications that are ordered here and any labs or pathology requests. The symbols will change based on whether the investigations have been ordered, collected or processed, and whether the results are normal or abnormal. This assists clinicians to know at a glance whether investigations have been completed.
Clicking on each tab at the top of Launchpoint will display different patient lists that have been curated for each emergency department. For example, we can click on this tab here to display all the patients located in resus. We can click on this tab to display patients who are awaiting triage. We can click on this tab to display all the paediatric beds, or click on this tab to display patients who've been referred to the mental health and AOD clinicians. Each clinician will be able to choose the tab that most helps their current workflow. Whilst looking at each tab, the Launchpoint banner then helps us to filter the view so that only patients that are relevant to us are visible. When we have assigned ourselves as to a patient, they'll appear under the filter of My Patients. Clicking on the Unassigned filter We'll then add those patients that have not yet been assigned to a clinician. Most doctors will work using these two filters combined with the tab for the area that they are assigned to. Launchpoint will kindly remember your selections each time that you log in and log out. Other filters, such as empty beds, waiting room patients, and no disposition plan, will help with patient flow.
Thank you for taking the time today and learning a little bit more about our new ED solution, FirstNet, and our new landing page, Launchpoint. For more information around our EMR Phase 2.1 project, head over to our digital health information site.